Okay, the next lactation gadget that we're going to talk about today are breast shields. So breast shields are different than nipple shields. We just talked about nipple shields. That's specifically for your breasts. But these are, I'm sorry, for your nipples. These are breasts. So they are actually for your nipples, but I don't know why they call them this, but they are for your nipples, for healing the nipples, but they call them breast shells. Don't ask me why. They just did. So breast shells are little hard plastic, sometimes soft on the inside, silicone, circular things usually, that you put inside your bra, because you have to have a bra or a tank or something to hold them on next to your nipple or breast. And they help with either sore nipples, like the two on the left, their shells and the soft shells. Those have a wider opening, so they're going to allow, and they have little holes on the top so air gets in. So those are going to feel nice if you have sore nipples, so your bra is not rubbing up against it, or your nursing pad's not rubbing up, irritating it even further. The one on the right is for inverted nipples, so it's the same concept, and it has the holes and everything, except it's a smaller diameter, so it's meant to go fit very close to the base of your nipple. And the reason that is happening, remember when I talked about everting your nipples naturally, just using your finger and thumb to rub at the base of your nipple because it plumps it up? Same thing with these is that little ring, that inner ring, sits at the base of your nipple and kind of does the same thing. It draws out your nipple if it is kind of flat or especially inverted. So it kind of it doesn't hurt or anything, but it just applies gentle pressure just to kind of pop it out a bit and harden it up. So you can put those shells in maybe even like 30 minutes before latching, and sometimes that will plump it up enough so when you take them out, they're ready to go for your baby. So you're going to want to, I personally like the ones that are called soft shells. There's something that they're soft. The one on the left that they're shells, it's hard plastic all the way around. But the soft shells, the two on the right, the soft shells and the soft shells for inverted nipples. So you can buy a soft shells for sore nipples or a soft shells for inverted nipples. So both of those, so the backing where it actually touches your breast tissue, that's softer and kind of flexible silicone. So that just feels a lot better. So I would recommend those if you are going to get this product. Avoid using too tight of a bra or tank, because these rings, if you push on them too hard, it can really push into the breast. If it's really leaving dark, deep indentations and red marks on your breast, then you probably should loosen up your bra some so it is in there, but it's not like pushing into you too aggressively. And that's what those are. Sometimes you can collect milk, of course, and there are some on the market that you can collect milk, and we talked about that in the collector's thing. Serves the same purpose. It keeps the bra off of your nipple if your nipple is sore. If you are collecting milk out of these are not a lot. Like if you're leaking a lot, these are not great for collecting. They're more awkward. So some of these come with little sponges, so they soak up the milk. If you do leak any, but if you're not a major leaker and you just want a little bit of relief after nursing, putting them in even for an hour after your nurse, these should be just fine. So that's another option, and again, hopefully you wouldn't have to use these for very long at all. It's just a soothing thing, maybe hopefully just for a day or two that you would use. So those I kind of like them. They're old school. They're really old. And they've been on the market a long time, but for certain situations, they really do feel nice. All right, thank you.